Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Dental floss is used for the removal of interproximal plaque, both supra and subgingivally. The typical location of interproximal plaque can be seen in this mouth after the application of a disclosing solution. Notice that the labial surfaces of the teeth are relatively clean, while there is an abundance of stainable plaque bordering the interdental papillae. Interproximal plaque is removed easily with dental floss. A floss holder may be used to position and facilitate the action of the floss. The dental floss cleans both the exposed and interproximal crevicular surfaces of the teeth. The floss may also be held between the fingers. The part of the floss that is soiled by the plaque can be moved away so that clean floss contacts the residual plaque. An unwaxed multifilament dental floss is usually used in preference to a waxed floss. Notice how the filaments become easily separated. The dental floss, therefore, can be flattened to a tape and contact a relatively wide tooth surface. The multiple filaments making up a dental floss can be seen. This forked instrument, called a floss aid, is one of several available dental floss holders. It has a screw mechanism for the attachment of the dental floss. The floss is passed from one arm of the instrument to the other and fastened to the screw mechanism. The arms are resilient, so the floss can be placed under tension. The threading of the floss will now be demonstrated. One end of the floss is wound around the screw mechanism. The floss is then passed between the two prongs of the floss aid, which are squeezed lightly together to place the floss under tension. The tension is maintained by winding the floss back around the screw. This tension is demonstrated here with the fingertip. The use of this floss aid device is illustrated on a typodont, starting at the distal surface of the maxillary second molar. To get through tight contact points, it is better to start with the floss that is close to one of the arms of the floss aid. The floss is carried all the way to the bottom of the interproximal gingival crevice and then brought upward toward the contact. This should be repeated at least 2 or 3 times for each interproximal surface. The distal aspect of the upper first molar is now cleaned. Notice the sweeping cleaning action of the floss as it is drawn toward the contact area. The floss should be used the same way for each interproximal surface. This will be demonstrated in one interproximal area from each segment of the dental arch. The anterior maxillary segment is first shown by flossing the mesial aspect of the upper right cuspid. Observe the careful placement of the floss and the sweeping cleaning action that is used during its removal. The floss should be carried to the bottom of the crevice. This is repeated several times. The same procedure is followed for cleaning the proximal and crevicular areas of the adjacent lateral incisor. The use of the floss aid in the left maxillary segment will be demonstrated by cleaning the distal surface of the cuspid. The floss aid is held in the same position for cleaning the mesial surface of the bicuspid. This particular tooth may have a concave mesial surface, which will make it difficult to clean by flossing alone. For the mandibular right segment, the floss is first placed behind the distal surface of the last molar. This area is difficult to reach with a toothbrush. The mesial surface of the tooth is flossed in the same manner. Notice the combined sawing, sweeping action that is used. This action is demonstrated well as the floss is brought forward against the distal surface of the first molar. The use of the floss aid will now be shown in the anterior mandibular segment by cleaning the mesial surface of the right cuspid. The floss is carried to the bottom of the gingival crevice. The same cleaning action is then used against the distal aspect of the adjacent lateral incisor. The proper position for cleaning the distal aspect of the left mandibular cuspid will now be shown. This instrument is particularly useful for those individuals who have limited use of their hands. The same position and action are used to clean the mesial surface of the first bicuspid. The use of dental floss in the floss aid will now be demonstrated in the mouth. Flossing is started on the distal surface of the upper second molar, moved forward to its mesial surface. Then to the distal surface of the first molar. Each of the interproximal surfaces in the right maxillary segment are similarly cleaned. Notice the sweeping action of the dental floss. The sawing movement should not be repeated too frequently, particularly in the presence of toothpaste. Abrasions may result, especially if the cementum is exposed. This close-up picture clearly shows the action of the floss aid and dental floss in the right cuspid and incisor areas. Care is observed when placing the floss into the gingival crevices not to injure the delicate soft tissues. The use of the floss aid device in the left posterior maxillary quadrant is now shown as the distal surface of the cuspid is cleaned. Once again, observe the action of the floss. The floss is moved to the mesial surface of the adjacent tooth. The floss aid instrument provides good accessibility to the distal aspect of the last mandibular molar. Tight interproximal contacts require careful positioning of the floss. When the tooth contacts are tight, it is important to place and remove the floss close to one of the arms of the floss aid. The floss may unravel and become flat and thin, which allows it to more easily pass through the contact points. The floss aid is now used in the lower anterior segment. As stated before, care must be observed not to traumatize the dental papillae. Notice how the position of the floss aid must be changed in order to reach the distal aspect of the right lateral incisor. The use of the floss aid in the left posterior mandibular quadrant is demonstrated on the distal surface of the cuspid. This is a mirror view. Flossing is also shown on the mesial surface of the first bicuspid. Observe how easily the filaments of the floss separate in areas of tight contact. Dental floss is usually held between the fingers instead of using an instrument. About 18 inches of the floss are cut off. One end of the floss is wrapped several times around the right middle finger. The other end is wrapped around the left middle finger. When the thumbs can be pointed together and touch with the hand stretched out, the correct working length of the floss has been established. The floss can be directed with the right forefinger and the left thumb, or the floss may be held between the right thumb and the left forefinger in a similar manner. This assures good control of the dental floss. A third finger position is to hold the dental floss between both forefingers. This position is used for all mandibular teeth. The distance between the fingers should be about 1/3 of an inch. For the right maxillary segment, the dental floss is held between the right thumb and the left forefinger, with the thumb on the buccal side, as shown in this view. The proper finger and floss positions for the cuspid area are to hold the thumb labially and the forefinger palatally. The same finger position is used for the distal surface of the lateral incisor. The use of the dental floss in the left maxillary quadrant can now be seen. The left thumb is positioned buccally and the right forefinger palatally. The same finger position and movement pattern may be used for the mesial side of the bicuspid and remaining posterior teeth. The floss must be held between the two forefingers to reach the distal aspect of the right mandibular molar. Notice the sawing movement that is used to get the floss past the tight contact between the first and second molars. The hands are merely brought forward to use the floss on the distal surface of the lower first molar. The sweeping cleaning action is repeated several times. The finger position and the use of dental floss in the lower anterior segment is shown by first flossing the mesial surface of the lower right cuspid. A slightly changed finger position is indicated for the distal surface of the adjacent lateral incisor. The correct finger position and use of floss for the left mandibular quadrant are shown. Observe the position of the fingers, how the floss is held, and the sawing action that is used. This same finger position is maintained for flossing the mesial surface of the bicuspid. Dental floss is an important aid in oral hygiene for everyone and should be used routinely once a day. This is especially true where the interdental papillae have been lost or interproximal fillings are present. It is mandatory for cleaning under bridge pontics. Notice how the floss is passed through the interproximal space and under the bridge pontic. Proper use of the toothbrush and dental floss combined will provide adequate oral hygiene for most individuals. The purpose of the circular scrub method of toothbrushing is to dislodge and remove bacterial plaque and debris from the surfaces of the teeth and the free gingiva. Multi-tufted soft toothbrushes should be used. The bristles are generally made of nylon, 6,000th to 9,000th inches in diameter, and 11/32 to 15/32 inches in length. There are 18 to 50 tufts in the brush, with 30 to 100 filaments in each tuft. The bristles have a resilient interaction as demonstrated with a dental probe. There is adequate space between the tufts of the bristles for cleaning the brush. The brush shown in this movie has longer bristles in the mid portion and shorter bristles toward the edges. This, however, is not an essential feature of a multi-tufted toothbrush. The ends of the bristles are blunt to prevent injury to the gingival tissues during brushing. Note the resilient action of the bristles when tested with the finger. The toothbrush should be held in a firm and secure grip. However, one should be able to rotate the handle so that the brush can be easily directed toward the various surfaces of the teeth. The bristles of the brush are kept perpendicular to the surfaces of the teeth and the surrounding gingival tissues. They should extend 1 to 2 millimeters apical to the free gingival margin, but definitely not to the mucogingival line. The circular scrub movements of the toothbrush are demonstrated. The brush acts on 2 to 3 teeth at the same time. With a continuous circular scrubbing movement, the brush is slowly brought forward to engage new areas. The action of the brush is shown in detail in this close-up view. The main portion of the brush contacts the teeth rather than the gingival tissues. The marginal gingiva, however, should be included in the brushing, as demonstrated on the right posterior maxillary teeth of this model. The circular scrub movements are now demonstrated on the labial surface of the maxillary anterior teeth. The palatal aspect of the maxillary left molars is also brushed. In order to reach the palatal aspect of the maxillary anterior teeth, the brush must be placed in an anterior-posterior position, with only a part of the bristles participating in the active brushing. The occlusal surfaces should also be brushed with a circular scrub action. It is important to develop a sequential order of toothbrushing to assure complete coverage of all tooth surfaces. Start with the buccal aspect of the right maxillary molars. Move forward to the bicuspids, cuspids, and then the incisors. Change the position of the brush for the left incisors, cuspid, left bicuspids, and molars. Be sure that the brushing is extended behind the last molar. Then change over to the palatal aspect of the maxillary left molars and bicuspids. Note the change in brush position for access to the palatal aspect of the anterior teeth. The right bicuspids and molars are then brushed. The sequence is ended by brushing the occlusal surfaces. Brushing the mandibular teeth should start with the buccal surfaces of the right molars. Note the circular scrub action that is used. The brushing is extended forward to the bicuspids and cuspid. The position of the brush is changed for the mandibular anterior teeth. A correct position for brushing the lingual surface of the mandibular left molars is shown. The brushing is extended forward toward the bicuspids. The position of the brush is changed to gain access to the lingual surfaces of the lower anterior teeth. The brush is held in an anterior-posterior direction. The occlusal surfaces of the mandibular posterior teeth should be brushed separately. The sequence of brushing the mandibular teeth should begin with the distal buccal aspect of the last molar on the right side, moving forward to the bicuspids, and then to the anterior teeth. The position of the brush is changed and moved from the left anterior to the posterior areas, ending at the distal buccal surface of the last mandibular left molar. Brushing is then performed on the lingual surface of the lower left molars and bicuspids, with a change in brush position for the lingual aspect of the lower anterior teeth. The brush position is again changed to gain access to the bicuspids and molars. Finally, the occlusal surfaces of the posterior teeth are brushed. The circular scrub method will now be demonstrated on a patient. The same sequence of brushing that was shown on the typodont will be followed. Note the circular scrub movements of the brush and the blanching of the gingival tissues. The action of the bristles on the teeth and the gingiva is also demonstrated in the anterior region. Note the cleansing of the junction between the free gingiva and the teeth. This, from a periodontal standpoint, is the most critical area for plaque removal. The position of the brush and its action are now demonstrated on the palatal aspect of the left maxillary posterior teeth. The end of most bristles work against the dentogingival junction in the palate, while a small part of the brush covers the adjacent palatal mucosa. Access to the palatal side of the anterior teeth can best be achieved by holding the brush in an anterior-posterior position and covering only one or two teeth at a time. Again, note the circular action that is used. Brushing the occlusal surfaces of the teeth is illustrated in the maxillary right quadrant. Care should be observed not to place too much pressure on the brush, or the tips of the bristles will not function well. The same circular scrub movements are demonstrated in the mandibular right quadrant. The position and movements of the brush when cleaning the labial aspect of the mandibular anterior teeth are shown in this scene. It is important to hold the tongue out of the way so the brush can be positioned against the lingual surfaces of the mandibular molars. The brushing should extend to the marginal gingival tissues as lingual surfaces are cleaned. The proper brush position and action for cleaning the lingual surface of the mandibular incisors are demonstrated. Finally, brushing is completed by scrubbing the occlusal surfaces of the teeth with the same circular motion. The mouth should not be opened too wide when the toothbrush is inserted, or the lip muscles may become taut. Notice that when the mouth is partially closed, the lip muscles relax and the brush can be brought into proper position. The same principle applies for access to the buccal surfaces of the mandibular teeth. With the mouth wide open and the lip muscles taut, it is impossible to place the brush in the desired position. With the mouth opened less widely, the muscles are relaxed and a correct brushing position can be obtained. Some patients have a problem with involuntary contraction of their lip muscles when a toothbrush is inserted in the mouth. In this case, it is helpful to hold the lip with the fingers while the brush is positioned and the teeth are cleaned. Disclosing solution has been applied to the teeth. This is helpful in demonstrating how plaque is removed by proper toothbrushing. Plaque adheres tenaciously to the teeth and has to be dislodged by the mechanical action of the bristles. Detergent action of a dentifrice will not dislodge plaque unless it is broken up mechanically. A beautiful smile showing healthy teeth and gingiva is the ultimate reward for good oral hygiene. The Bass method of toothbrushing, correctly employed, removes dental and intraclavicular plaque. This method includes both the use of the toothbrush and dental floss, but this film will demonstrate only the toothbrushing part of the Bass technique. A multi-tufted brush, such as Right Kind or similar type, is used. The tufts of the bristles should end in a slightly rounded tip, and the end of each bristle should be blunt. Note the separation between the bundles of bristles to facilitate cleaning the toothbrush. The bristles are resilient, and each bristle is about 7/1000th of an inch in diameter. The blunt end of the bristles is a safeguard against injury. The toothbrush should be held in a firm grip with all the fingers. The brush can be rotated in the hand to provide access to various areas of the mouth. Proper placement and action of the brush will now be demonstrated on the typodont. The brush is placed at approximately a 45-degree angle to the teeth, with the bristles pointing apically. Part of the brush covers the buccal surfaces of the teeth, while other bristles extend over the occlusal surfaces. The bristles penetrate into the gingival crevice, while the brush handle is being moved in small rotary or vibratory movements, without actually changing positions of the tips of the individual bristles. Several teeth may be covered simultaneously by the brush, while it is gradually moved from one area of the dentition to another. Proper brush position and bristle action is illustrated in this close-up of the distal buccal aspect of the last maxillary molar. The correct position and action for cleaning the palatal surfaces of the maxillary molars and bicuspids is demonstrated. The position and action of the brush must be changed for the palatal side of the maxillary anterior teeth. The occlusal surfaces are partially cleaned, while the buccal and lingual surfaces are brushed. But it is advisable to finish the brushing by directing the bristles into the occlusal surfaces with small vibratory movements. The following sequence is recommended for brushing the maxillary teeth. Start with the buccal surfaces of the maxillary right molars, moving up to the bicuspids, and then to the labial surfaces of the front teeth. Continue with the left front teeth and move to the buccal surfaces of the left maxillary bicuspids and molars. Change over to the palatal surface of the left maxillary molars, bicuspids, and palatal surfaces of the anterior teeth. Then move to the palatal surfaces of the right bicuspids and molars. Brushing the occlusal surfaces of the molars and bicuspids completes the cleaning of the maxillary teeth. The brush position for the buccal aspect of the mandibular posterior teeth is now demonstrated. Again, note how the bristles are placed into the gingival crevice. The brush is gradually moved forward, one tooth at a time. The position of the brush for cleaning the lingual aspects of the mandibular posterior teeth is shown. Again, note the vibratory movements that are used. In order to reach the lingual aspect of the mandibular anterior teeth, the brush must be placed in an anterior-posterior position with the bristles pointing into the gingival crevice. The brush should not be pulled forward as shown here, since this will prevent the bristles from entering the gingival crevice. When the brush is placed in the proper position, the bristles will enter the gingival crevices and at the same time clean the teeth. The sequence of brushing the mandibular teeth is as follows. Start with the buccal aspect of the mandibular molars and bicuspids on the right side. Move forward to the anterior teeth. Then shift to the left anterior teeth, bicuspids and molars. Switch over to the lingual aspect of the left molars, bicuspids, and the lingual aspect of the anterior teeth. Finish with the lingual aspect of the lower right bicuspids and molars. Then brush the occlusal surfaces of the mandibular posterior teeth. The Bass method of toothbrushing will now be demonstrated on a patient. Brushing is started at the buccal aspect of the right maxillary molars. The brush is first placed on the teeth and the bristles allowed to slide into the gingival crevice. Small vibratory movements are made. Note the blanching of the gingival tissues in response to the pressure of the ends of the bristles. In order to clean an area of gingival recession, it may be necessary to change the position of the brush so the bristles can be worked into the gingival crevice and clean the entire exposed tooth surface. As a result of previous faulty toothbrushing, this patient has experienced some gingival recession. In spite of the rigorous but faulty toothbrushing, she has not been able to keep her teeth free of plaque. Areas of gingival recession and irregularities of gingival contour may require special modifications of toothbrushing in order to accomplish complete plaque removal. Brushing of maxillary molars and bicuspids on the palatal side will now be demonstrated. Note how the bristles are placed into the gingival crevice with the resultant blanching of the gingival tissues. This is the proper brush position for cleaning the palatal aspect of the maxillary anterior teeth. If an anterior pull is made on the brush, the teeth and the gingival crevice will not be adequately cleaned. Observe the different action of the bristles when the brush is used correctly without pulling the handle forward. Finally, the occlusal surfaces of the maxillary posterior teeth are brushed. As previously demonstrated on the model, the bristles are directed into the occlusal surfaces with small vibratory movements. The brush position and action for cleaning the buccal aspects of the mandibular molars and bicuspids will now be demonstrated. Note how the bristles enter into the gingival crevice and remove the plaque at the cervical areas of the teeth. Brushing is extended to the anterior teeth using vibratory movements. It is important that the brush is placed in the correct position to reach into the gingival crevice on the lingual aspect of the posterior mandibular teeth without interference from the tongue. The bristles should also be directed into the gingival crevice on the lingual aspect of the mandibular anterior teeth The brush should not be pulled forward because the bristles will bend and cannot enter the gingival crevice. Proper action of the brush may also be achieved with the lower incisor teeth separating the bristles, as long as the bristles are allowed to enter into the gingival crevice. Brushing the occlusal surfaces of the lower posterior teeth is now demonstrated. This patient has not maintained oral hygiene for 4 days in order to demonstrate patterns of plaque formation and plaque removal. Disclosing solution has been applied to the teeth. Note the heavy plaque formation on all teeth at the gingival margin. The plaque adheres tenaciously to the surfaces of the teeth, and considerable effort is required to remove it. The brush position and action for cleaning the maxillary posterior teeth are demonstrated. Also note the brush action on the left cuspid and bicuspid.
You've been listening to a presentation from the University of Michigan School of